initially that you have increase in hair fall. So what will happen is when you start with minoxidil, there will be increase in the shedding phase. So in the first month, you will see that there is more hair fall. But don't do the mistake of stopping that, because that is a known effect of minoxidil. Hello everyone, I'm Dr. Deepam Shah, founder and medical director of Viva Aesthetic Clinic. So today we're going to discuss a very important topic for hair, which is minoxidil. So minoxidil is one of the major solution or major treatment which is available for hair fall. This is US FDA approved, so it is one of the best modalities of treatment for hair fall. Today we are going to discuss something about the side effects of minoxidil, because that's a very frequent question which repeatedly is being asked to me. So when you start with minoxidil, there are certain things which you can face. So the first most common thing which people face is dryness of the scalp. Second one which we face is increase in the dandruff or increase in flaking of the scalp or seborrheic dermatitis. Some people can also get a very minor allergic kind of a reaction where they can have a little itching of the skin, mild redness or boil eruption, which can be noted. We also can notice initially that you have increase in hair fall. So what will happen is when you start with minoxidil, there will be increase in the shedding phase. So in the first month, you will see that there is more hair fall. But don't do the mistake of stopping that, because that is a known effect of minoxidil, which starts settling down by 2 to 3 months. Then there is one very minor kind of a side effect which is called as increase in palpitations. So what happens, there are people who are very enthusiastic about application of minoxidil. So what they'll do, they'll apply a lot of minoxidil on their scalp. So when this happens, it helps to, systemic absorption of minoxidil happens. This leads to increase in the blood absorption of the minoxidil, which will cause a little bit of palpitation. So don't use a minoxidil in higher quantities. 1 ml is recommended twice a day if you're using 5%, or 1 ml every day at night if you're using the 10% minoxidil. This is about minoxidil. Do subscribe to our videos if you liked our content. Thank you.